Thank you for tuning in to yet another edition of COVID-19. I'm Min San-hee. While domestic transmissions appear to be within manageable levels, the number of imported cases is on the upward trend, given the surge in infections worldwide. Accordingly, in today's studio session, we explore ways to safely coexist with the virus until a vaccine or cure is found. Let's begin now with the latest figures on the pandemic with our Kwon So-ah and related news with our Hong Yu. So, how are we ending the work week here in Korea today?
Well, Sunny, for 2 consecutive days, COVID-19 cases here in the country have been at 60 or above. So that is a concern also because today we are seeing quite a rise in local infections, which are back to the 20s. So let's take a closer look at the figures. We have 60 new cases and 21 are local infections and 39 are imported cases, bringing the total to 13,672. 2 additional deaths, bringing the death toll to 293. While 919 people are in quarantine and 12,460 people have fully recovered from the disease. Now, if we go over to our graph here, the rising imported infections are what's a growing concern, especially on days when we were in the 60s, just like today. That's when the proportion of imported cases has been high as well. And now let's move over to our map. If we take a look here, the new cases did not occur in too many places this Friday, but we do have 15 in Gyeonggi-do province and 9 in the capital Seoul, and 10 out of these in Gyeonggi-do were imported cases and 2 here in Seoul were imported cases as well. And then a concern here in Gwangju, 5 local transmissions. We know that recently Gwangju had hardly any new cases, so here the figures have been rising again. And now let's go over to our international updates. So we have a total of 13.9 million cases with some 255,000 additional COVID-19 cases and also some 240,000 new recoveries, which means the number is pretty similar when it comes to the new cases and the new recoveries. And more than 5,800 people have lost their lives in the span of 24 hours. And let's move over to our major outbreaks. The U.S. is seeing exponential hikes with over 78,000 new cases, bringing the total to 3.69 million. And Brazil and India also hit a new milestone, with Brazil hitting 2 million and India 1 million cases. And South Africa here has become the country with the 6th highest infections in the world, with over 324,000 cases, which means if we go over to our next table, it now has more cases than all of these 6 countries, and it just surpassed these in the span of around a week. Meanwhile, Mexico also has a lot of new cases at 324,000, adding some 6,000 new cases. And those are the figures I have for now, but I'll be back after the government briefing. Sunny?
Right, so thank you for that for now. Staying on the peninsula, North Korea, as it claims, may be free from COVID-19 infection cases, but the country remains vulnerable to COVID-19 economic consequences. I have our North Korean affairs correspondent Hong Yu in the studio for more on this inevitable reality. Welcome, Yu. Right, Yu, let's begin with the severity of the economic situation up north then.
Yes, Honey, international sanctions had already taken a heavy toll on North Korea's economy even before the COVID-19 pandemic. But the situation looks to have worsened. The Korea Institute for National Unification predicts that prices for food will skyrocket. In their latest report on prices and exchange rates in the North Korean market, the think tank said market volatility has risen in the north compared to last year. With the border shutdown in place, trade between Pyongyang and Beijing has also plummeted. So there are less supplies flowing into the north, prompting ordinary citizens to stock up on goods, thus triggering inflation. There is also analysis that the North's policy change in restricting imports, issuing government bond, and selling import permits for foreign currency could have influenced market prices and exchange rates. North Korea's economic woes are compounded by the international sanctions on the regime that still remain in place. And most importantly, North Korea is practicing social distancing and strengthening its disease prevention measures. So production has also slowed down, leading to lower food yields.
Right, Yu. So is the South Korean government providing any assistance to its northern counterpart then?
Yes, the National Assembly tabled a bill to provide humanitarian assistance to North Korea to help them contain COVID-19. ruling party lawmaker An Min-seok proposed the idea to promote cooperation with the international community in this regard. That includes supporting private organizations that want to participate in humanitarian aid projects. He added that this is an effort to mend inter-Korean ties, as well as to promote peace and denuclearization on the Korean peninsula. But no matter how much we want to help the North, nothing can happen if the North does not respond. And that is why much of our hopes are riding on the new unification minister. The nominee for Minister of Unification, Hyunkyung, said right after his nomination that he will go over ways to foster humanitarian cooperation and stress the importance of reopening dialogue with North Korea. We will have to wait and see how the North reacts once the new unification minister takes up his post.
How about the international community? Are there efforts there to assist North Korea?
Yes, North Korea has taken the delivery of thousands of face masks and thousands of COVID-19 test kits. The International Federation of Red Cross and Red Crescent Society says 4,000 face masks and 10,000 test kits arrived in North Korea last week. And other supplies are also on the way. They are set to be distributed by the Red Cross Society of North Korea, with the UN granting a sanctions waiver on aid shipments back in February. The Swiss Agency for Development and Cooperation has delivered sanitation goods to 30 hospitals in North Korea in mid-June. It announced Wednesday that people in Pyongyang and 8 provinces received supplies worth around $58,000. The SDC says they are preparing to send personal protective equipment such as protective suits, surgical masks, hand sanitizers, gloves, and goggles worth around $37,000.
Now despite claims of no COVID-19 cases in North Korea, the country itself appears to be taking stringent disease control measures.
Yes, that's right. The North Korea state-run newspaper Nodongshinmun reported Wednesday that enhanced disease preventive measures have been adopted in North Korea lately. And it called for vigilance amid the worsening pandemic across the world and resurgent outbreaks in neighboring countries. Land borders and ports remain closed, and supplies coming through them are being closely monitored. Goods that come in through ports and train stations must pass an inspection and meet disease prevention requirements in order to be let in. The regime is making sure that people coming in through ports are being tested for the virus, and waste materials on board vessels are being safely disposed of. The North is also promoting better public awareness of COVID-19 so they can check themselves into a hospital if symptoms appear. In Samjian City, all workers and residents are wearing masks, washing their hands often, and boiling water before consumption, as orders by North Korean leader Kim Jong-un.
I see. All right, thank you for that coverage. Hope to see you again soon.
My pleasure.
Right, we turn now to the regular government briefing on COVID-19 here in the country. As part of efforts to tackle growing cases of imported infections, authorities here have asked all arrivals from high-risk nations to submit certificates that show they tested negative for the virus 48 hours prior to departure from their respective countries. The names of 4 nations have been disclosed and include Bangladesh, Pakistan, Kazakhstan, and Kyrgyzstan. 2 more nations have been included in the high-risk category, but their names have yet to be revealed, with officials here citing diplomatic reasons. Also, on the subject of diplomacy and COVID-19, President Moon Jae-in and 7 of his global counterparts have highlighted the importance of allowing access to vaccination for all countries. In a jointly authored opinion piece published in the Washington Post, the leaders agreed that immunization is the key to ending the pandemic only if all countries have access to the vaccine. They also made note of the disproportionate effects of the pandemic on vulnerable populations. Meanwhile, back on the local front, authorities have set up an alert system at 50 major beaches in the country. The system will ban the entry of additional visitors in crowded areas to stem, that is, the spread of COVID-19. Under the new alert guideline, officials will issue a red alert when the number of visitors challenges efforts to maintain effective social distancing in the area. Rental services for beach equipment will also be suspended during the red alert phase. And come July 25th, vacationers, that is, will not be allowed to eat nor drink at beaches after sundown. Violators will face fines of up to 3 million 1. We are still waiting for that briefing to commence, and perhaps while we do, we can take a look at the daily life quarantine measures for those of us here in the country to ensure that we keep safe from the virus, especially in light of the coming weekend tomorrow. Do stay home for at least 3 to 4 days if you find yourself sick, and do get yourself tested if you believe you may have been exposed to the virus. Stay 2 arms length away from each other to keep yourself safe as well as those around you. And do wash your hands for 30 seconds. Cough into your sleeves, of course, to keep safe. The briefing is about to start. We'll come back to you afterwards.
First of all, here is Director Chung Eun-kyung with the explanation. Let us now begin our regular briefing for the COVID-19 situation here in South Korea. As of July 17th, we have 21 new local infections today and 39 new imported cases. And the total number of confirmed cases now stands at 13,672. 64 more people have been discharged, and right now we have 919 people in quarantine. We had 2 additional fatalities, unfortunately, yesterday, and the death toll now stands at 293. I extend my deepest condolences to the deceased and the members of the bereaved families. And here are some major updates on our domestic infections. In relation to a door-to-door facility at Hwanagu District, Seoul City, we have 2 additional cases among the visitors, and now the accumulated number stands at 13. And in relation to a door-to-door sales group in Gyeonggi-do province, we have 1 additional case being confirmed, and now in total we have 42 cases as of now. And in relation to the Siheung Seoul Daeho Nursing Hospital in Siheung City, Gyeonggi-do Province, we have 1 additional case, and we have a total of 14 people being confirmed. And we also have tested all of these people, and we are currently conducting our epidemiological investigation as well. And in relation to the Hanwha insurance, we have 1 additional case, and we have also a total of 8 people being confirmed as of now. And in relation to a door-to-door sales group in Gwangju City, we have 3 additional cases. The total now stands at 147. And the newly confirmed people were in relation to the badminton club. There were 2 people in relation to that, and 1 person in relation to the Hanul Nursing Hospital. And we have some updates on the imported cases. We had a total of 39 cases yesterday, and at the point of entry, we have 25 people being confirmed. Also, 14 were reported while they were on self-quarantine. 8 of them were from US, 20 from Russia, 6 from Iraq, 3 from the Philippines, 2 from Uzbekistan. And in relation to the Regul vessel, which is a Russian flagship that embarked in the Busan port, after we have identified the index cases, we have conducted testings of all of the sailors, and we have 14 confirmed cases who had no symptoms, and all of the 17 people that have been confirmed had no symptoms. And we have identified 28 Korean contacts of them, and as of now, we are conducting the testings. And also, regarding another vessel, shipping vessel, we have 1 confirmed person, and also 2 more people have also been confirmed at a separate Russian-flagged ship. So as for the increase of the confirmed cases among the Russian-flagged ships, starting from July 20th, among these vessels, the vessels that have a high portion of the number of contacts with the local workers, we will carry out the diagnostic testings for all of these sailors. And the KCDC has also continued to highlight, and we also ask the public to utilize the proper ways of face masks. And here are some reasons why we need to wear face masks. First, it helps to prevent your respiratory droplets from spreading to others, as well as vice versa. It can also protect yourself as well. It is the most effective method that can protect yourself. If you do not wear a face mask, compared to wearing a face mask, you could have up to 5 times of higher infection rates. And we carried out an epidemiological investigation. When you have traveled for an hour during in a very small and tight environment inside a vehicle, we have confirmed that there were no additional infections. And also even at hospitals, there were patients who were inpatient for about 7 days and were exposed to the virus. However, there were a group of people who had poor wearing of the face mask and wearing of the face mask in inappropriate ways. And there were 4 people who had tested positive, and all of the medical practitioners, 17 of them wore face masks properly, so they were able to protect themselves from the virus. And also there was a patient who went to a certain clinic for 3 times, and this person was infected. However, all of the 13 others at that hospital were not infected because they wore face masks. And also there was also a case when a infected person visited the church for 3 times. However, all of the other participants and worshippers wore face masks, and there were proper supervision as well, so there were no additional transmissions. As we can see from these cases, if you wear a face mask, you could prevent yourself from any respiratory droplets. So when do you need to wear these face masks? We have mentioned numerous times. If you are at an indoor space where you cannot keep 2 meters distance, you are highly advised to wear face masks. For instance, if you are at a religious facility, public transportation, restaurants, public multi-use facilities, and so forth, you need to wear your face masks. And as for nursing home care centers, as well as people who are providing care at these nursing hospitals, you need to at all times wear your face masks. And in relation to a survey of the public in their acknowledgements of the need for wearing face masks, from all of the ages, the respondents said that they agreed on the need to have the face mask worn at multi-use facilities. And however, they also see that there were a lower level of awareness that they could take off their face masks at restaurants, cafes, or bars or office spaces. So we would like to highlight that if these facilities, if you are unable to keep 2 meters of healthy distance, you need to wear face masks at all times, especially at restaurants, cafes, or at bars. You also could be prone to any respiratory droplets. So aside from the time when you eat your food, you need to wear your face masks. Then also many people ask us, when then can you not wear your face mask? So if you are outdoors and if you can keep 2 meters of healthy distance, you are not advised to wear face masks. If you go outside for a stroll, a walk, or jogging, or cycling outside at a park or jogging lane, if you are able to keep 2 meters distance with others, you are not mandated to wear face masks. So here are some warnings that you need to keep in mind. If you are under the age of 24 months, or if you are having respiratory problems and problems in breathing, when you wear a face mask, you should not wear face masks. And here are some ways that you always need to remember. First, you need to cover your nose and your mouth. And second, you cannot touch the surfaces frequently. And you also need to wash your hands or disinfect your hands after touching the face masks. So we also provided this diagram to help your understanding. If you open your nose and do not cover your nose with the face mask, you could also be prone to the infections of respiratory droplets. So it is very important that you cover up both your nose and mouth. And also you need to make it tight so that there is no empty space between your face and the mask. So the mask needs to be worn very tightly. And if you have the mask in your lower head, in your jaws, that would not be helpful in preventing yourself from the virus. And if you touch your mask frequently, you can also be prone to infection. So please do not touch the exterior of the face mask so when you take it out, so please utilize the strings that you have on your ears only. And when you take off your mask after that, please wash your hands or disinfect your hands. And tomorrow is a weekend, and marking the weekend, we ask you to continue to abide by quarantine measures and refrain from going outside for gatherings. And please cancel or postpone your gatherings and outings and switch to non-face-to-face alternatives. And if you are going to physical services at places of worship, please restrict the number of participants and also wear your face mask and wash your hands and do not dine together in a group, and also do not sing and rather play the musical instruments as well. And please remember that COVID-19 can spread at 3C conditions, which is closed, crowded, close contact environment. So please refrain from going to multi-use facilities like singing rooms and PC rooms and so forth. Right now, the international society is currently witnessing a rapid spread of the COVID-19. This means that the virus is not free from any country. And here in the metropolitan area as well, the Gwangju, Daejeon, and even in Jeju Island, we are seeing more infections that are spreading here in South Korea. However, thanks to the public support as well as the participation by the public and the dedications put forth by the medical staff, we are currently curbing and flattening the curve of the virus. And however, if you are exposed to closed, crowded, close contact environment, we can also have another resurgence of the outbreak, so we cannot stay off guard as of yet. And it is very important that we need to have a new norm of how to live together with the virus. And despite some inconveniences, it is very important that we change our ways of life to make a very safe manner. Throughout the past 6 months, that is, at multi-use facilities, including schools, hospitals, and office spaces, and so forth, we have been devising measures and putting in place some measures to prevent the virus and infection. And we are successfully controlling the virus to a certain extent. At the first beginning of starting of the offline classes, there were many concerns from the public. However, we did not have a widespread of the cluster infections that centered around schools. Nevertheless, we witnessed continued infections centering around restaurants, cafes, as well as small group meetings and religious group meetings. And there are also some rooms for improvement in terms of quarantine measures. So we need to also sustain our routine daily lives as well as economic routines. And it is very important for us to recognize this stage as a grace period where we set up a new norm of life. Although we long for the pre-COVID-19 era, we are given this change and it is inevitable. Therefore, it is very important that we avoid closed, crowded, close contact environment and wash our hands frequently and frequently disinfect frequently touched areas as well. And please comply these measures as well. And please make it a habit to comply with these measures. And the quarantine authorities will continue to exert our full efforts as well. Thank you very much.
All right, that was Hyunkyung, the head of KCDC, with Friday's afternoon briefing. So, what was the gist of her briefing?
Well, let's take a look at the imported cases. We have almost 40 new, and some 20 cases were from Russia. And that is because there have been additional cases on a Russian ship. That brings the total to 17 linked to one Russian flagged ship. But there were also 2 other Russian flagged ships that had COVID-19 patients, which means in the span of 1 month, on 6 vessels, there were more than 40 new cases. And that is a concern as we are having more and more Russian ships here in the country, and especially that can also affect South Korean nationals due to the loading and unloading processes. And that's why the government is focusing its strengthening its measures at those seaports.
All right, so thank you for that. Take care. We'll see you back here on Monday.
See you on Monday.
Right, today, July 17th, marks Constitution Day here in Korea. And in light of this occasion, our Chun Song-cho is at the Constitutional Court here in Seoul to see how COVID-19 prevention efforts are taking place there. Hello, Song-cho.
Good afternoon, Sunhee.
So, Song-cho, do fill us in on what you've learned so far.
So I'm at the Constitutional Court of Korea located in Jongno-gu District, northern Seoul. Well, the reason why I'm here today is Constitution Day, July 17th. So today is the day when we South Koreans celebrate and remember the proclamation of the Constitution 72 years ago. Well, this was the day when South Korea took a step to really truly become a democratic, open, and liberal nation. So right now, I'm inside the courthouse, and to be more specific, I'm in front of the grand courtroom. So this is where arguments and decisions are made for some of the biggest and most significant trials there are. So if you want to take a look inside, follow me. All right, so this is the grand courtroom. Well, I don't know if you feel it too, but I feel almost overwhelmed by the sense of calmness and solemnity of this space right now. So this is where the justices sit and rule on whether the laws that are being challenged are unconstitutional. So basically, for instance, if they conflict with the constitutionally established rules, freedoms, and rights, among other things. And final decisions on presidential impeachments are also made here. And to ensure transparency and fairness, the Constitutional Court of Korea is divided into three different bodies: the administrative, judicial, and legislative bodies. And it's composed of 9 justices who have all been appointed by the president. Now, if you're a South Korean citizen and you want to see it for yourself how the trials are run here, then you can actually go on the website of the Constitutional Court of Korea online and request for a field trip or to attend a trial. So if you're the lucky one, then you'll be selected and allowed to have a seat right here in the public gallery. So this is where you'll be sitting during a trial. Now, from justices to visitors, so many people visit this building on a daily basis, but we're living in the era of COVID-19, and sharing the same space and facility with so many people doesn't sound like a safe idea, right? So I'm sure there is a set of really strict quarantine measures in place. And for more on that, I'm going to speak directly to one of the officials from here, from the court, and he's here with us, Mr. Cho, Kim Sang-jin, excuse me. Good afternoon, welcome to our show. All right, so delivering justice is really important, but we have to make sure that we do it in a really safe manner. So what kind of measures have been enforced by the court so far?
Okay. We strictly follow all the rules and guidelines set up by the government. So in order to get into this building, you have to wear this face mask, and also your body temperature will be measured. So if it's too high, I think it's 37.5 degrees, you cannot get in. So last time when we have the public hearing, even a lawyer couldn't get it because of this high temperature.
Oh, wow.
And also, we try to keep a social distance. So whenever we have a public hearing or the delivery of a judgment, we assign certain specific seat numbers to the people who attend these events, so that people still keep their social distance.
Oh, I see. And just as I was looking around, I saw some plexiglass walls being set up on the podium as well. And I heard that, well, some other courts in Seoul have postponed their trials or even reduced the number of deliberations due to growing health concerns. So what about this court?
Actually, we don't cancel or postpone, the trial or the delivery of judgment. But nowadays, we currently stop running our visiting program by which people can visit and see us. But also we'll resume that program too if once this situation is getting better.
I see. All right. Thank you so much for your time this afternoon. Thank you. Wow. I only have respect and gratitude for everyone who works here, because thanks to their commitment, South Korea is able to keep the wheels of justice turning even during this global pandemic. This has been Chun Sung-cho reporting live from the Constitutional Court of Korea, and back to you, Sunny, in the studio.
All right, Song-cho, thank you for that coverage.
유행을 종식한다는 표현은 기대일 뿐입니다. 결국 코로나19 바이러스를 극복하면서 함께 살아가는 방법밖에는 없습니다.
While efforts to find a cure for and a vaccine against COVID-19 continue, authorities are also highlighting the need to learn to live with the virus for the time being. For more on this reality, I have Professor Alice Hyunkyung Tan from MizMedi Women's Hospital. Welcome back, Dr. Tan.
Thank you.
And I also have Professor Tak Sang-woo from Seoul National University.
Hello.
Hello, Professor Tak. Professor, we'll start with you. Comparatively speaking, the number of infections in the city of Gwangju has been on the decline in recent days, that is, compared to earlier on this month. Do you believe this trend can be linked to enhanced social distancing practices in the city of Gwangju, where authorities raised their level to 2?
Yes, I think it's definitely showing the effectiveness of the social distancing that has been practiced in everywhere in the country. But it has to be combined with the rapid identification of those people who may be infected or contact with those newly confirmed cases. And I was glad to hear that Director Jung Eun-kyung talked about the effectiveness of wearing a mask. With these preventive measures are more important than ever as we prepare for the second wave of the COVID-19.
Of course. Dr. Tan, do you believe that Seoul should also perhaps raise its social distancing to level 2, given the sporadic cluster infections we've been continuing to see here in the capital city?
Well, Korea's policy has been to assess the situation holistically, not just nationally, but regionally as well. And there are certain criteria that we're looking at in terms of deciding when to move between the alert levels, and they include the amount of hospital bed space and the availability of medical resources, the number of daily new cases, also how big the clusters are, and then how many cases we're seeing outside of our surveillance network. The Seoul metropolitan area has not met these criteria yet, so I don't think we need to escalate the alert level quite yet. However, we do need to keep in mind that the numbers that we're seeing now reflect the behaviors and the policies that were put in place 2 to 3 weeks ago. And right now, whatever we can do, the citizens can do to practice social distancing and good respiratory hygiene, hand hygiene, those will limit the spread of infection and limit the chance of amplification of infections. So what we're seeing now reflects what happened then 2-3 weeks ago, but it's very important to take more stringent measures now.
I see. Professor Tak, on a slightly brighter note, the percentage of untraceable infections has marked a drop to 8% from more than 13% earlier on in the month, of course. What do you suppose has led to this decline?
Well, I think it means that the emergency responders on the field are working harder than ever. But I think we can safely assume that the contact tracing has been done more effectively than before. And then with this kind of rapid identification of those potentially exposed people, I think we can see gradual decreasing of the cases. So in the time comes.
Right. Dr. Tan, as I mentioned prior to the briefing that we had this afternoon, in a bid to tackle imported cases, the government has required arrivals from high-risk nations to hand in certificates that show they tested negative 48 hours before departure. How effective do you believe this measure will be?
I think it is a rational measure that we're taking, as long as it's done in conjunction with the quarantine, the 14-day quarantine that's required, and then the testing, that's the repeat testing that needs to be done within 72 hours of arrival. And also, I think people should be given ample time to prepare for the documentation that they'll need so that travelers are not caught off guard. If you consider Thailand, they had a similar procedure in place since April. They're a country larger than ours, 70 million people, and they've seen a fourth of the cases that we've seen, despite their very robust tourism industry. They've had only 58 deaths as well. So for Thailand, this system seems to have worked, and so certainly I think in the future we can expect a decrease in the number of imported cases once we have this implemented fully.
Right. We take a moment now to turn our attention to Canada, where authorities remain on high alert to contain the virus as the country shares its border with the US, the worst hit country in the world. I have Dr. Rama Nair at the University of Ottawa live on the line. Hello, Dr. Nair.
Hello.
Let's begin with the situation in Canada. What can you tell us about the situation there so far?
Well, actually, right now it's not too bad. I think we are at the tail end of our first wave. So the provinces are beginning to open up the lockdown, and some businesses are being opened, but with restrictions. Even social gatherings are allowed in a limited basis. So we are beginning to see the end of the first wave. We are hoping.
I see. Dr. Tan, if you have any questions you'd like to ask Professor Nair, please go ahead.
So Dr. Nair, thank you so much for joining us. As we all know, Canada was one of the few Western countries that was particularly hard hit by SARS back in 2003. So with COVID-19, I think the country moved pretty rapidly to put in a travel ban against all incoming non-Canadian travelers. And I was wondering, how would you assess the success of this measure in terms of controlling COVID-19 in Canada?
I think that played a major role in controlling and us getting to the stage that we are in now, especially considering south of the border, you know what's happening. And once we closed the border, it reduced the import of the cases. Nevertheless, we still have travel between the United States and Canada to some extent, because we are very much dependent on the economy, and our own existence depends very much. So we do have essential travel, and then there is a quarantine that happens. So that helped tremendously.
Dr. Nair, how do you foresee the second wave of COVID-19 playing out?
Unfortunately, I'm not very optimistic because we don't have a vaccine, and south of the border things are getting really bad, and we ourselves, the population here also is getting very itchy that they want to get out and socialize. It has been 6 months held up. So as soon as we start opening it up, people are going to forget about all the restrictions that we have been doing, and that makes me worried. So I'm just hoping a vaccine or some other method will come up pretty quickly.
I see. All right, Dr. Nair, thank you very much for making the time to join us live at this hour.
Thank you. That was my pleasure.
Right. Professor Tak, do you share Dr. Nair's negative outlook on prospects of COVID-19 in the future?
Well, to be more precisely, vaccine may be available by the end of this year or probably early next year, but that doesn't mean that we'll get the vaccine immediately. The access to the vaccine may be, limited depending on many different factors. So, I think it's safe to expect that we will be facing the second wave of COVID-19. So we should be really ready for the, negative potential outcomes of that.
Right. Dr. Tan, it appears that medical experts are putting quite high hopes on blood plasma therapy to treat COVID-19. Could you tell us a bit more about this method of therapy, using layman's language for the sake of our viewers?
Well, first of all, it's still an investigational therapy, but basically there are 3 steps. First of all, we find a donor, a potential donor, and that would be someone who's recovered from COVID-19 and 2 weeks have passed and they're feeling fine. The second step is then to have that person donate their plasma through a process called apheresis. We screen then the blood for neutralizing antibodies and also for potential other infections that might be harmful to the person receiving the treatment. And then that's the third step, is actually transfusing the convalescent plasma. It's like a blood transfusion into the the patient. Now, in terms of the treatment, in the past, it seems that it works best as a preventative measure, and it works best if it's given early on, so at the earliest onset of symptoms. And so that's going to be a little bit tricky in terms of applying it for COVID-19, because right now we seem to be saving it for the sickest of the sick. And so it may not be as effective for those patients compared to if it were used earlier on.
I see. Professor Takin, while efforts continue to find a vaccine treatment for COVID-19, what can be done to better prepare Korea's healthcare infrastructure for this protracted pandemic?
Well, assuming they will be facing the second wave of COVID-19, there will be a medical surge. A recent analysis showed that there will be a limited number of ICU beds that's going to be available for those who are really sick. And in that case, we'll be seeing some of the healthcare facility and capacities being overwhelmed by the number of patients. So I think that's critical to see that potential impact, so we should be prepared for it. And the second one is the responders' health and safety, including psychological health and well-being. So we are seeing a lot of negative impact, upon those responders. So we should be, taking care of those before the second wave hits us.
Do we not have a tangible safety net for these responders, so to speak?
I think we are learning a lot about how we can protect them, but we are still in, baby step.
Of course. Dr. Tan, in the meantime, what can members of the public do to better prepare to better balance, let me say, their efforts to keep safe from the virus and also to ensure a sense of normality in their lives in the time being?
Well, I think right now we've made the measures that we all know work. We've made them accessible. We've encouraged people to do them. And then we've also given outlets for people. As the director said today, there are certain instances in the outdoors when people don't need to wear a mask. There are certain safe activities, fun activities that people can do even in the context of COVID-19. So I think it's this balance, as you're saying, of applying these infectious disease control measures in everyday life and making sure that everyone does them all the time, and yet finding these outlets for normality, fun, enjoyment, the arts, entertainment. This is the tricky part, I think, of living with COVID-19, which is something that we're going to have to do for many more months.
And if there were two things that you would highlight that would be very important to keep safe, what would the two things be?
Physical distancing, wearing your mask, hand and respiratory hygiene. Sorry, that was three, but I would say those are the three most important.
I see. Professor Tak, what about you? What would you highlight?
Well, the same thing, but I think we should also preparing for the second wave. I think we should be thinking about those who are actually still on the field and taking care of
others.
On
the front lines.
Yes.
I see, making sure that they're psychologically and physically
That's right. It's not too much emphasized that.
Right. No. All right, Professor Tak, as always, thank you for your thoughts. And Dr. Tan, as always, thank you for being with us today.
Thank you.
Right, that brings us to the end of this week's edition of COVID-19. Be sure to tune in again from next Monday. In the meantime, do abide by the safety precaution measures against the virus and do refrain from venturing into places that could raise your chances of infection. Also, do reach out to us with your thoughts and inquiries via our social media accounts or homepage, arirang.com. Have a safe weekend.
With social distancing measures getting updated, people are slowly getting back to their everyday life. However, in order to minimize the risks of COVID-19 infection, we must get used to sitting 1 seat apart when using public facilities. In crowded places, sitting at least 1 seat away from each other can reduce the risks of catching the disease that is said to be transmitted through respiratory droplets. In movie theatres, sit a seat apart from each other, as well as on planes,